Tonight, my first guest is Dr. Michael Jones, who is an interventional cardiologist at Baptist Health. Welcome.
Thank you so much.
Now, you're also a practicing physician because you take care of a lot of patients, you take care of a lot of my patients, but you also do some research, and you've got a new trial going on.
We do. The trial that I want to talk about this evening is a trial called Crest2. Crest2 is a trial that we're a part of. It's sponsored by the National Institutes of Health and the Mayo Clinic. The Crest2 trial is a trial to allow us to understand how we can best prevent stroke in people with asymptomatic blockages in their carotid arteries.
Now, you mentioned carotid artery. Tell me explain that to people to where that is and why it's so important.
Well, the carotid arteries are vessels. There are two of them, one on each side of the neck, and they take blood from the heart to both sides of the brain, the fronts of the brain. And these arteries are very important in maintaining function of the brain, but they can become clogged in a manner similar to coronary arteries becoming blocked and causing heart attacks. So when these arteries become partially blocked with plaque, which contains cholesterol, fats, other lipids, and inflammatory cells, and in fact blood clots, part of these particles can break off and travel to the brain, where they can completely block smaller vessels and cause an ischemic stroke. So we want to know what we can do in patients who are asymptomatic to prevent this from happening to them.
All right, now, as a cardiologist, you do stenting for the heart, you take care of heart attacks. This is like a brain attack, and you're looking at the treatment options. So explain Crest2 and how the trial's set up and what it means.
Well, for a long time, we've known that if a patient has blockage in the carotid arteries and a TIA, which is a warning of a stroke, or a minor stroke, the best way to prevent a larger stroke down the line is to either do an operation called an endarterectomy to remove the plaque or blockage, or put a stent in there. Crest1 told us that both of these treatment modalities, are essentially the same. Now, moving forward with that, Crest2 is going to address the people who are asymptomatic. And in fact, of the people that come to our office and the offices of doctors in this country, about 80 to 90% of the patients with carotid disease are asymptomatic. We want to know how best to treat them.
Well, if you're how do you know then you've got a disease? How do you figure that out if you want to be in the study?
Well, our accrediting agencies make recommendations for whom should be screened. And basically, we think you should be screened for carotid disease if you have a carotid bruit, which is a noise in your neck caused by turbulence from plaque that your doctor can hear. Or we would recommend that you be screened if you have at least 2 risk factors for stroke. And these include smoking, high blood pressure, high cholesterol, a family history of stroke, or a family history of early symptomatic vascular disease that is under the age of 60. If you have 2 or more of these things, we think that you should be screened, and the screening technique is the carotid duplex. It's an ultrasound of the neck. It's a very good test for finding and assessing the severity of carotid stenosis.
So somebody might be interested in being the test, or some of the physicians that may be watching. How do they get involved?
Well, I think that people who are asymptomatic, obviously by definition don't have symptoms, they should be screened if they're at risk. And we've just gone over the things that would trigger a screening in these patients. After that, we would ask the patients to consider enrollment in Crest2. The thing is, we don't know in asymptomatic patients what the best treatment is. We don't know if best medical treatment alone is the best way to go, or best medical treatment combined with a carotid stent or carotid surgery is the best way to go. So we're going to recruit, and there are about 104 centers doing this in North America now. We're going to recruit about 2,500 patients over the next few years. And half of these patients with carotid blockage that is asymptomatic, and over about 70%, half of these patients will get only best medical therapy, directed at smoking cessation, control of diabetes, treatment of high blood pressure, treatment of high cholesterol, antiplatelet therapy with aspirin, etc. The other half will get treatment. Half of the half will get carotid endarterectomy, where the plaque is removed surgically, and half of the half will get a carotid artery stent. And we're going to follow these patients for up to 5 years to see whether or not medical treatment alone might suffice to treat patients with asymptomatic carotid disease.
Well, that's great information.